Hello, everyone. Welcome to the second episode of Careers in Care, a podcast designed to provide more information about careers in health and healthcare administration. I'm Praneeth Saja,
I'm Aman Modi.
and not here with us today is Meghna Verghese, another member of our project. We are Cure for Care, a project aiming to help raise awareness about and develop careers related to healthcare administration. It is our great pleasure to have Mr. Rajanikanth Kanyaboina, owner of the Pediatric Center of Round Rock, to discuss the healthcare administration industry, give some insights into the field, and share his own experience. Good morning, Mr. Kanyaboina. Thank you for spending your valuable time to be a guest for us today.
Good morning. Thanks for having me.
To get started, Mr. Kanyaboina, can you introduce yourself and tell us what you do for a living?
Sure. I worked in healthcare administration and strategy side all my life since 2001 to now. In my current role, I co-founded a pediatric primary care group. We started with one location in Round Rock, and now we have 6 locations, 5 in Austin and 1 outside Austin. And my day-to-day responsibility is kind of split into 2 parts. One part, operationally responsible for managing the day-to-day activities of these 6 locations. And the second part is focused on how do we grow the business from here, not only grow the in location or in practice revenue wise, patient volume wise, but also how do we expand beyond our current set of 6 locations.
Okay,
I
so
see.
were you always involved from like the beginning of your career in healthcare administration, or did you pursue like any other careers?
I started my career on the technology side of healthcare. Uh, I don't know how many of you remember or know the details within the healthcare, but I mean, typically when you go to a doctor's office or when you see a doctor, uh, you remember that interaction, but you might not know how much technology goes behind the scenes to
Mm-hmm.
make sure a doctor's office or a hospital runs smoothly, right? There is so much technology that helps in the operations of the practice or operations of the hospital. And there is so much technology that is available now, which helps in diagnosis of the conditions that patients come up with, right? I mean, there is so much technology
Yeah.
which will help image your body and kind of pinpoint where the problem is.
Mm-hmm.
And also now the technology has gone beyond where there are some robotic surgeries and things like that that
Mm-hmm.
are happening. So I started on the technology side of healthcare, kind of looking at look what are some of the technologies that make sense in healthcare at that point in time.
Okay.
And that's how I got to know more about what are various healthcare settings and how do they operate and what are some of the things that go on to make healthcare function smoothly, right? So I started on the technology side and now I'm more on the management, administration and strategy side of things.
Okay.
Okay.
That kind of brings us. Oh, okay.
Okay. So I was just mentioning about how you, I guess, progressed from just the technological side to opening 6 locations, and I think that's a very huge progress for a pediatric center.
Sure. From there, I went into what I call as an advisory role. Basically, I was consulting and helping some of the bigger healthcare institutions which have multiple hospitals in multiple cities. I was advising their leadership, senior leadership, on how they can leverage technology, right? How they can,
Mm-hmm.
what are some of the things that they need to do to improve their technology breadth and depth so that they become relevant for next 5 years and 10 years. When I was doing that, it kind of exposed me or that I would say is the bridge between my current role and my technology role.
Okay.
Yeah.
So that kind of like ties into our next question. So your current role is that of a healthcare administrator. So
Uh-huh.
what exactly is healthcare administration, and what like what types of jobs and responsibilities does that career encompass?
Sure. So healthcare administrator role depends on the type of healthcare setting you're part of, right? I
Mhm.
mean, there are several different types of healthcare settings. If you just look at the patient care side of things, there is the outpatient or the primary care, and then there are the specialist physicians who offer specialty care for something which is much more narrow or much more focused on one body part versus another. And then there are settings like the bigger hospitals, right? So the
Mhm.
healthcare administrator role is kind of different in different settings. It depends on whether you are talking about a one doctor physician office versus a physician office which has multiple locations like ours with multiple doctors,
Okay.
and
So
also
mid-size branch.
the hospital, right? But
Mhm.
the way I look at an administrator role is somebody who has the overall responsibility of making sure everything within that healthcare setting works fine. So
Okay.
patient care is the ultimate endpoint. When a
Mhm.
patient visits a particular setting, offering them the care they need and they deserve is the final outcome. But for that to happen, there are so many other functions that happen within healthcare.
Mhm.
For example, if you look at your typical neighborhood physician practice or your pediatrician's practice, then there is somebody who is taking your phone calls, scheduling your appointments,
Mhm.
and there is somebody who is looking at doctor schedules to make sure which doctor is available that day. And there is somebody who is prepping the patient before the doctor comes into the room, right?
Mhm.
Uh, all of you might remember when you go to your doctor's office, sometimes you might have received shots, but there
Mhm.
is somebody who is looking at your past medical record, coming up with list of things that you missed and list of things that you need to have. And then the doctor comes in and talks to you and performs the visit. But all those functions uh, happen in the background or they happen behind the scenes, right? And the administrator role, one side is to make sure all those things are happening the way they are supposed to. So they are more of a somebody who is orchestrating all the processes, all the functions to make sure we offer the right patient care. And the
Okay.
other side of administrator's role is to make sure the financial health of that healthcare setting
Uh-huh.
is appropriate, right? I mean,
Right.
uh, I spend probably 60% of my time looking at the numbers, looking
Mhm.
at what are all our costs, what are all our revenue streams, where are we getting the revenues from, is there a possibility to increase the revenue, is there a possibility to decrease the cost, and what should we be doing with some of the changes happening in the world right now, and how do we
Okay.
survive, how do we plan to take our organization forward, right? I
Mhm.
mean, it is pretty similar to like a CEO of any
Mhm.
tech company or any other normal companies that you guys
Yeah.
might be aware of on a day-to-day basis. So the role is partly operational and partly strategy, right? Operational
Mhm.
part, making sure everything is functioning the way they are supposed to, and the strategy wise is making sure the organization is doing well financially,
Mhm.
and it is kind of addressing the growth aspect
Yeah.
of that organization.
So from like a
Okay.
business aspect, you have to be conscious of what's happening in the hospital, but you always have to keep in mind that the primary goal is to provide the patients with the best care possible.
Absolutely, yes.
Plus, whenever normal citizens hear about healthcare administration, healthcare, they just generalize that it's purely based on taking care of the patients. But as you just mentioned, it's a lot more than that, and there's a lot of overlaps between the skills that are common between other fields. For example, you just gave an analogy of how a CEO of a tech company might be related to healthcare administration, which clearly shows that all the skills, or actually the majority of the skills, are applied in this field.
Yes, if you don't mind, can you repeat the last part one more time, Aman? I
Oh
missed
yeah,
it.
for sure. I was just mentioning about how all the skills are overlapped between a CEO of a technological company. It might
Yes,
not
yes.
seem to be as it might not seem to be similar as according to other people, but if you really think about it, and as from your perspective, It really does, because you need to manage, and there's so many things that goes into healthcare administration.
Absolutely, yes.
Um, this brings us to our next question, which is, what inspired you to pursue a career in healthcare administration? Did you always know that this was your profession that you wanted to pursue from the very beginning?
I was a technologist at heart. At the beginning stage of my career, I was interested in how could I use my technology background to build stuff, right? To build products and things like that. But when I looked at healthcare, I kind of felt like this industry is very unique that you don't see it in any other industry, right? For example, you go to Walmart, you buy something from Walmart, you know exactly how much you're paying for the product you're buying from Walmart, right? But in healthcare, the uniqueness about the industry is nobody knows exactly how much it's gonna cost, right? When you go to a doctor, and it's not that anybody is gaming the system, it is not that anybody is cheating the system, but the way the healthcare is set up in this country and for most part in several other countries across the world is there is so much inefficiency or so much ambiguity that goes on in the background that kind of appealed to me, saying that, hey, look, this is something unique that I would not get in any other career or any other industry, right? And also, when I started my career in 2001, and when I looked at all other industries versus healthcare, healthcare is at the lowest end of the technology adoption.
Okay.
I mean, there are even now there are some hospitals which are at the cutting edge of technology and all that, but there are so many players or so many institutions within healthcare who are not using technology at a level which is creating them the efficiencies or benefiting them. So when I look at things like that, right, I mean, I felt like, look, this is an interesting problem to solve, or this is an interesting problem to be part of.
So real good.
So you're like drawn to like the uniqueness of healthcare as an industry because it combined like business, technology, and caring for others. But you also like were interested in pursuing healthcare specifically because you felt that you could make a larger impact in that field.
Absolutely. I mean, the reason I was mentioning the uniqueness aspect of it is, I mean, the amount of impact you could create, right? I think, and in health and healthcare on the other end of the spectrum is the industry where sometimes that impact you create is very emotional and very personal too, right? I mean, we see in our pediatric offices all the time, there are kids who come in with even the common illnesses, right? Like the fever, cold, and things like that. And when you treat them or kind of create that path, by the time they leave, it's all smiles, right? I mean, you are able to address a problem and you are able to see the outcome of the way you address that problem right away. So that is more fulfilling or satisfying part of the job or being part of healthcare.
And plus, you had it clearly shows that you had an interest in the very beginning to bring a change, because, as you just mentioned, technology isn't being as utilized in the healthcare administration field. It could have been utilized more, but you wanted to bring a change into it and show how technology could also severely aid healthcare administration.
Yes, Aman, right.
So to like find your passion for this field, were there any like activities that you did or any like experiences that really like showed you that this is what you wanted to do?
So when I first started, it happened by accident, right? I mean, I was a fresh grad out of Master's in Computer Science program from University of Florida, and first thing I want to do is get a job and pay my bills, right? I mean, whatever I incurred during my master's program, I'm like, look, I want to do something to get a job. But once I started in healthcare, right, when I started developing technology for some of these institutions, I was like, look, can I go and shadow a doctor in a smaller setting, right? Or can I go and shadow a administrative staff inside the hospital to kind of see how they are using my technology and what are some of the ways that they are interacting with the patients, right? So I try to volunteer, even though it is part of my employer or part of my work. I always took opportunities to go and visit some of these healthcare organizations across the spectrum, the smaller ones, larger ones, and everything else you can imagine in between. I always went there to see things in action, and that kind of uh, created a new interest for me, or it motivated me to stay and continue in healthcare and kind of figure out, look, what can I do here and how can I create.
Okay.
Mhm.
So like really like going out into the world of healthcare and seeing like how like doctors interacted with patients, how the technology was being implemented, that like led you to like a better understanding of the healthcare world, and then that led you to like wanting to like make a change.
Yes, Pranay.
So this kind of ties into the previous question. What skills did you learn from these activities, and how did these skills apply to your future in healthcare administration?
So the skills I learned from all those previous roles or jobs I did is to see stuff in action, right? I mean, to see how healthcare is being delivered and experiencing that firsthand. I mean, you don't see all of it. I mean, the only other scenarios where you possibly might see that is if you yourself are a patient and experiencing something and going through the system, right? Other than that, you don't get to see how healthcare is delivered in action. So when I looked at all that, uh, the skills I acquired as kind of see how products are put into practice, right? Or how solutions or services are put into practice. And what are some of the ways that you, as a creator of those products or services, wants them to use, but how they are actually using it, right? I mean, sometimes you might come up with this cool little technology that as a creator of the technology you kind of felt like, oh look, this can be done this way, this can be done this way and all that, but when you give it to the end user, their job or their task at hand is much different, right? They might be using it for something else. It's like iPhone can do 1,000 different things, but if somebody is using it only to chat or only to take pictures, then then you know, oh look, maybe there is a segment of population that uses it only for pictures, or there is a segment of population that uses it only for chats, right? So that was one skill to kind of see how things go into practice or how end users are using it, right? And also that kind of helped me understand what are the gaps that exist in the marketplace when you walk into any particular type of healthcare setting. What are some of the things that they are doing really well, and what are some of the things that they are struggling? Maybe a new process or a new technology or a new ability would help them to do those things efficiently. And also, what are some of the needle movers or the impact creators for those, right? So that kind of created a list of things for me that I want to do in future, right? I mean, for now, I'm focused on how do we help these smaller one doc, two doc independent practices by bringing them under one umbrella where they can continue doing what they do best, which is offer the best possible care to the patients, but don't have to worry about the financial aspect of things, and we will run that for them so that they can do more of their core expertise. That is one area I identified and I created a business around that. But I also understood several technology gaps that might lead to other technology products in future. I might start out and create companies with help of somebody like you or Praneeth who could come and build those products for us, right? So those are some of the ways I might evolve in future, but it helped me understand or put things in perspective, if that makes sense.
Okay, so
So
like, come on, I can talk.
okay, so I was just mentioning about how exposure is really important, and that kind of guided you to change your path because you started with you planned to go into the computer science field, but getting exposed to healthcare administration and just finding how there are some just the technology isn't being utilized as much, that kind of guided you to change your path because mainly you're exposed to it and you experience that firsthand.
Yeah,
And on top of that, like, getting all that exposure allowed you to like analyze the healthcare businesses, which I think it's like very important as like a business manager, because you need to analyze the business that you're running. Even though it's like a hospital, it'll have like so many factors and components. So analyzing.
absolutely, Praneeth. And you were saying one thing earlier, right? I mean, like typical perception of a common person is like healthcare institutions are there only for patient care and they should not be talking about business and those kind of things.
Mhm.
But a financially sound business
Yeah.
can offer the care in the best way possible.
Hmm.
But if they are hurting financially,
They cannot
it
offer.
might end up being where that institution gets closed, right? I mean, we all live in big cities like Austin.
Mhm.
So for you, getting access to care is not a big deal, right? I mean, there are several different options available and all that. But imagine a small rural town where somebody focused just on the patient care, but they did not worry about the business or financial aspects. Then uh, if they leave that town, then there is nobody to provide care in that town, right? So
Mhm.
I think uh, contrary to the common perception or the popular perception, the business and financial side of things are really important too. They are important for any organization, right? Even for not-for-profit organizations or the voluntary organizations that help the community and help the people. Somebody needs to look, here are all the donations we are getting, and here are all the activities we could do with that, right? And how do we increase the donations so that we could do more for the community? How do we do it in a way where our costs are low when we are doing such activities? So I think uh, that aspect, I personally feel healthcare could use a somebody like me, or when I say like me, not just me, but people who have that business mindset or the financial mindset who can do all these things in the background. That way the actual healthcare providers, which are who are the nurses, doctors, and all the supporting staff they have, they can just focus on their core task, right? I mean, the more people like us go into the field, we can kind of look how can we make a doctor's job easy so
Easier.
that he can just focus on the patient
Focus
care
on
and not worry about anything else.
finances.
So healthcare administrators' role primarily depends on how do I make the doctor's life better so that they can offer the best care for the patient.
Mhm.
Mm.
So going slightly on a different topic. So going to like college and higher education, which areas of study did you pursue? And why did you choose these particular areas? And how did they tie into your healthcare administration career?
Sure. I mean, that time I had no idea what I was going to become when I grow up, right? I mean, I was good with analytical thinking, and I was getting excited about maths, solving problems, and things like that. So that naturally led me to an electrical engineering degree. That was my undergrad. And while I was doing electrical engineering, I was getting more and more interested on the programming or the coding side of things. So I ended up pursuing a master's in computer science. And then that time, like if you had come to me in 2000 or 2001 and asked me, Raj, what would you do? I would have said, like, I want to start in a technology company and probably retire in a technology company, right? Because I was just focused on the creating side of things. But healthcare kind of helped me to put that in perspective by exposing me to how people are using our creations, right? So that was first part of your question. I forgot your second part of the question. Did I answer your question, Pranay?
Yeah, I think you answered my question perfectly. So
Yeah.
Mhm.
basically, I think it's I think your like experience and your career path is like an important example of how it's important to like not close yourself to different
Yeah.
careers because like of what you study in college, because you never know where you're going to end up or what
Yeah.
you love doing.
What I would add to that, Pranit, is
Mhm.
I think when you are young, you kind of misunderstand that a technology person would always remain as somebody who is attached to a computer and always programming, right?
Mhm.
But that is not the case. I mean, even though I'm doing administration and management and all that, I still consider myself as a technology person, right? Just because I'm doing everything else, I know what are the problems that exist and how I can solve them with technology. So I always have that going on in my brain.
Okay.
So
Mhm.
I think passion wise, long story short, the reason why I'm saying all that is passion wise, pick whatever you are good at, right?
Hmm.
But that skill has multiple applications. I mean,
Correct.
just because you're interested in computer science does not always mean you would be sitting in front of a computer and developing programs one after another, but you are also using that to figure out how to solve the problems in the world, right? So the core skill you have, follow your passion, but that might lead to several different possibilities. So stay open for that,
Okay,
if that
so
makes sense.
okay, I'm sorry for interrupting you, but I was just going to apply that how it's important to look at multiple perspectives because I can give my example itself. Whenever I think of computers, I just think of programming, and there's nothing beyond it. But however, you kept open to those options, you had those options available, and even though it might seem ideal for a student doing um, majors and interests in maths and computer science to enter healthcare field, it might seem unusual, but still you applied all those important lessons and skills from those passion and your majors to healthcare administration.
Absolutely, very well said. I think that's what I was trying to say. Your skills would be used in several different industry types, right? I mean, whatever I'm doing in healthcare administration, if I kind of look at maybe some other random industry, right? For example, like retail industry, like Walmart and Target, maybe I can come up with similar things. I think that core skill set would help you to stay focused on what you're passionate about, but it could lead you to multiple different paths. That time you can pick the path that is closer to your heart and then go in that direction.
Um, Similarly, branching off to that question, how prepared did you feel for the business field once you graduated? How did you start your career? What are some of the challenges you also encountered? But that's the second part. But for the first part, how prepared did you feel once you graduated from college?
So like when I went to my master's in computer science and then later I went to business school. Uh, when you graduate from college, then it is like an open book, right? I mean, everything is a possibility for you. I came in with a very open mind. Like I was jokingly saying earlier, that I wanted a job so that I can pay off my bills, right? So I was looking for who is hiring now and how do I uh, get to that, right? But I didn't have any idea on which industry or like healthcare could offer this, or healthcare could lead this, or retail industry would lead this kind of a thing, right? I didn't have that perspective. But at that time, I don't want to be narrowed down because of that, right? I mean, I wanted to make sure I cast a wider net. That way, I'll get whatever I want. But in the hindsight, right, if I had known more about healthcare while I was studying, then I would have taken few other courses to get more understanding or learn more about healthcare. But unfortunately for me, it did not happen that way. I kind of figured it out after the fact. But if I had known earlier, then I would have kind of took a different path during the college itself to see, look, what can I do or what else I can learn so that I'll be better equipped when I go to.
Okay.
Okay.
Is that what you are trying to ask, Aman? I'm
Oh,
sorry if
for
I asked.
sure. It
Okay.
was exact. So I was just mentioning about by changing your interest and your passion, do you encounter any challenges by changing this, or any challenges even entering the field? Did you encounter any obstacles that could
Right.
potentially divert your mind?
I see. Yeah. I mean, if I tried to enter healthcare administration right out of my master's, right,
Mhm.
then it would have been super difficult. I would have never made it to what I was doing. Luckily for me, the entry happened with my core skills. And from there, I kind of got exposed to other things, right? So that entry was a bit unusual. I mean, you wouldn't see somebody coming with that background getting into the role I got into right now, right? So that was definitely a challenge. If I had to do it, I mean, if there is a master's in computer science graduate or a engineering graduate who wants to get into healthcare administration, right? There will not be a direct one-to-one mapping, or you cannot just go from engineering to that. What advice I would give them is go and find a healthcare administrator in your community. Maybe it is somebody who manages the hospital or somebody who manages a practice like me, and just tell them, look, my background is different, but I want to shadow you and I want to learn from you.
Okay.
And that might be a best way for somebody to enter administration, healthcare administration that way. And if you don't get entry that way, then you kind of have to figure out what is it that they are hiring for within that healthcare organization. Let me go and apply for that job. That might be skill set wise, pay wise, much below than what an engineering graduate can do. But start that way so that you get exposed to and learn more about that institution and go from
Okay. Thank you for your answer on that. So, kind of relating to that, so we talked about the challenges that you faced entering the field. How about like in the career of healthcare administration? What challenges did you face? Like, for example, many hospitals face challenges with the COVID-19 pandemic
there.
because they were just simply overwhelmed by the sheer quantity of patients that needed care. So, are there any other challenges faced by you personally in your career?
Sure. I mean, of course, the pandemic, which is fresh on everybody's mind and which is an active problem we are all dealing with, right? The challenges or the hurdles we faced with the pandemic side is if you look at the healthcare organization spectrum, you have hospitals on this end and you have smaller outpatient primary care practices like ours on the other end, right? This pandemic kind of completely disturbed our regular volume. I mean, the number of patients we were seeing, the kind of revenue we were generating so that we could pay everybody, that went down. I mean, as a administrator or somebody who is managing these practices, you kind of there are only few growth surges or demand drops that you kind of anticipate based on your past experience. For example, typically during summertime, the volume would be low, and the wintertime, the volume would be higher because of the seasonal sicknesses and things like that, right? I mean, this pandemic kind of changed all those assumptions. I mean, you're randomly thrown into this scenario where the demand dropped at the beginning of the pandemic very badly. And then now the demand kind of peaked to a level where we are not able to address that. Because initially, everybody who is suspecting that they have COVID or exposed to COVID, they were running to the hospitals and not going to any of the outpatient centers. Now they are like going to their doctors first before they go to the hospitals, right? So the challenge for us is, look, I mean, you can never plan for a pandemic, right? I mean, if you try to plan for a pandemic and ramp up your resources, then you will be accumulating too many resources on your end, and your costs will increase all of a sudden, right?
It would be like good
And
away.
there is no point in having those additional resources on board and increase your costs.
Yeah.
But at the same time, when something like this happens, right, how do you address those demand drops and demand surges?
Mhm.
Is an important lesson that we are still trying to decode and figure out how do we do that, right? I mean, of course, we did the obvious things by cutting down everybody's hours and looking at our expense stack to see, look, what expense makes sense to push it out to the next year, right? Instead of spending that money now, can we do it next year? And also, when the demand surge happened, we are trying to figure out, look, how do we ramp up? I mean, we are not a factory. You cannot just put in 2 additional machines and start producing more. And doctors are not that easily available to just recruit out of the street and bring them into the practice, right? So those are some of the things that we are learning now. I mean, how do you try to address these demand surges and demand drops, and how do you plan for future?
Okay. So it seems to me that it's like a crucial challenge to like balance preparedness with
Mm.
costs of the hospital because
Yeah,
you want to ensure that you're like ready to care for the patients, but you also don't want to waste resources.
yeah,
Yeah.
yeah.
So, like, what advice would you give to someone wanting to enter the field of healthcare administration?
Healthcare. So I think uh, one of the misconceptions or one of the wrong notions is like to be in healthcare, the only option you have available is be a provider, right? That provider could be a doctor, provider could be a nurse or a therapist or somebody like that. But there are several different options or ideas available within healthcare. So my first advice would be don't narrow yourself down
Yeah.
thinking that you have to be a doctor to be in healthcare, right? I mean, there are several different options that are available. So explore what is out there, and then figure it out which one appeals to you more, right? Even after doing that, if you feel like, look, I want to be a doctor or I want to be a therapist, then go for it. But kind of understand and explore the healthcare better. And the second advice is to do that exploring part. Do what you did, Praneeth. I mean, basically go find somebody that you could volunteer or talk to kind of understand what they do and how they do things. And then maybe something that they do appeals to you, and that will help shape up your career too, right? I mean, those two things. And also, the final thing would be it doesn't matter what your core skill set is, right? I mean, programming is one thing, but your other core skill set could be you're good in communication, right? I
Yeah.
mean, healthcare could use lot of good marketing and good patient communication, right? When I say marketing, it is not about selling the practice or selling the doctor's time, but it is about effective communication with your patients, right? For example, this is the year of the pandemic we all are struggling with, but still there are a lot of families who are not interested in getting a flu shot because there are so many misconceptions around flu shot
Yeah.
that actually getting the shot would make you sick. And if there is somebody who could come up with a right message saying that, look, flu shot is good for you, and it is more important to get it this year than any of the previous years, right? Because now you cannot isolate the possibility between whether it was flu or whether it was COVID
Okay.
19, right?
Okay.
So, I mean, irrespective of what your core skill set is, uh, healthcare is an option because there are so many other things other than just the patient care
Yeah.
that happen. So, stay open or keep an open mind, and you don't have to change your core skill set or fundamental focus just because you chose it.
Okay. I was just wondering about how students in the current generation whenever they think of the healthcare field, they start thinking about 8 years of college and loans and debts once they come out of it. And a lot of them get scared and they don't feel as confident. However, I think they should also explore options like healthcare administration because not necessarily all the fields in healthcare administration relates to a doctor's job.
Yeah. And
Um,
also, I mean, they don't have to worry about spending 8 years in college to be a doctor, because once you go through those 8 years, then you are doing something amazing, right? I mean, like there is only one person in this world who could make the other person feel less pain or make their pain go away, right? And that is a doctor's job or a nurse's job. And we are seeing how important it is, especially during something like this, right? I mean, so I think that should not deter you or make you worry. And coming to bills and those things, right? I mean, you always have to make that financial assessment as you're going through. Probably the type of profession, and rightfully so, doctors are paid better. And then maybe that would help you to pay off your bills sooner. And you don't have to worry about you paying all your bills until you're 90. Maybe like once you become a good doctor, maybe you can pay off your bills before you're 35 or whatever it takes. I'm just providing a number there. But yeah, I mean, I think the years in college and those things, you should not worry about those things. You should focus on, look, what is your calling or what is your passion, and what does it take to achieve that passion.
Yeah, I definitely agree. For me, like I think you should just like follow your passion and think about like finances and those other factors like later on. The
Yeah.
most important thing is doing what you want to do.
Sure, and hopefully there are enough tools and solutions in place in terms of loans you can get and things like that, which are relatively low on interest and which will give you a longer timeline to pay off and all that. So, I mean, if you want to become a doctor, absolutely go for it. But also make sure you understand that healthcare does not employ only doctors, right? I mean, there are so many other roles
Mhm.
that healthcare industry offers.
Okay. Really insightful response. And going to the last question, Mr. Kanyaboina, how has healthcare as an industry or career changed over the years? And how do you think healthcare will continue to grow in the future?
Sure. I mean, in terms of growth in future, definitely we will start seeing more and more technology in healthcare. And choice is one thing which healthcare did not have in the past, right? I mean, typically somebody gets sick and there are only limited things that they can do. But in future, there will be more and more choice that is available. And uh, people will start realizing the transparency. I mean, maybe both of you would not deal with this because your parents might be paying with their health insurance when you go to the doctors and all that. But now that health insurance that is offered by employers to their employees and their families, that is going to change a lot in future, which means there will be more shopping around, more understanding of the costs from the patient's aspect before they start consuming anything within healthcare, right? Um, what was the first part of your question, Aman?
Oh, the first part of the question was very similar. How do you think healthcare as an industry changed over the years? So, how
Yeah,
is it different, like when compared to 20 years back or 30 years back, and how is it a bit
sure.
different?
So I think historically or traditionally, the way a doctor or doctor's office gets paid is every time you walk through those doors, doctor sees you and doctor gets paid for that visit, right? But there is no incentive system or incentive alignment where, I mean, I'm not saying doctors are bad or healthcare institutions are bad, but there are no incentives put in place where they get incentivized for making sure somebody like Raj feels better all the time, right? I mean, so far the incentives were for treating Raj when Raj is sick, but there were no incentives for paying the doctors for making sure Raj always stays healthy. So that is what the whole industry is calling as um, pay per
Mm-hmm.
visit to pay per value. So in future, there and healthcare is slowly transitioning in that direction. But in future, there would be incentives in place where doctors would get paid for taking care of the patient when he's sick, but also making sure the patient stays healthy too, right? I
Mm-hmm.
mean, we call it as health care, but historically and traditionally it was primarily sick care, right? You are sick, you go to the hospital, and then you get paid for it.
Yeah.
But
Mm-hmm.
that is going to change if that makes sense. Mhm.
Yeah, thank you so much for answering all of our questions. We took a big chunk of your time, and I know you have a busy schedule. So thank you so much for.
No problem. Absolutely. I enjoyed the conversations, and those were very good questions. I mean, I'm happy to have this conversation.